Good morning, all of you. Myself, Nikki Arora, student of Toy Ohomai Institute of Technology of Infection Risk Management, standing in front of you. And today we will discuss about the topic that is the hospital-acquired infection, which are also known as the nosocomial infections. So, nosocomial infections or the hospital-acquired infections, they are those infections acquired in the hospitals or the healthcare services are the infections that appears in the hospital unit within the 48 hours of the admission of the patient. Means these kind of infections can be commonly seen in the hospital areas after the admission of the patient. As we know, there are the many microorganisms which are responsible for the infections. They are present in the hospital settings. We are not talking about the hospital settings, but in the community areas also you can see them very commonly. But these microorganisms are the too small and cannot be seen with our naked eye. So most of the hospital-acquired infection is caused due to the contribution of microbes present in the hospital equipments, infected health workers, or even the patients. Yes, as these are the tiny particles, they can't be seen with our naked eyes. These are present in the everywhere in the airs, on the contaminated foods, and the surfaces contaminated, which are contaminated in the hospitals or in the community area. So therefore, this paper will illustrate the mode of transmission of infection and evidence-based infection control guidelines used in the New Zealand and internationally in the following paragraphs. So, there are so, as we have discussed, that there are so many microorganisms like E. coli, S. aureus, Mycobacterium tuberculosis, pneumonia, and so many others, which are entered into the human body and causes of further complications. They are affecting the body system-wise or the organs. And sometimes these infections can become the fatal if these infections become in the severity. So, their mode of transmission, as we have taken evidence from the part A, here I am talking about the S. aureus, which is commonly known as the hospital microorganism nowadays, and many of the people are getting affected by the S. aureus. So, mode of the transmission is the direct contact. Direct contact means healthcare personnel like the doctors, nurses, whenever they are going to treat the patient, they are touching patient without wearing the gloves or they are touching any surface or they are shaking hands, they can directly contact these microorganisms by their hands and throw the injection into the body. Second is the airborne contact. Airborne, yes, these microorganisms are freely roaming in the air, and whenever we visit to the crowded places or the public areas where so many infected persons are roaming, and they sneeze, they cough without using the handkerchief, these microorganisms roam freely in the air, and when another healthy person inhale these organisms into their body, they get affected by the several diseases. They affect their respiratory system, gastrointestinal system, and moreover the skin problems, and many more. And then is the droplet transmission. Yes, droplet transmission is also whenever someone is sneezing, coughing into the free air, and other healthy person is acquiring that infection through their breathing, and it directly enters to your lungs. And then last one is the contaminated food, water, and the medicines. Yes, now, some food materials we are eating which are raw material which are not properly cooked and they are contaminated by the insects or the unhygienic, like they are carrying they carry some of the microorganism which are present on their surface, and we eat that food material which goes directly into our digestive system and gets we are affecting from the various digestive problems like the nausea, vomiting, and the diarrhea, constipation, and the food poisoning like the conditions. And sometimes bloating may also occur. So, risk factors of the S. aureus. As here we are talking about the S. aureus. The S. aureus, it affects the infection of the blood. It is known as the bacteremia. Yes, if it's entering into the blood, it is known as the bacteremia, which affects the WBCs, platelets, TLCs, and many other constituents of the blood, uh, which uh, which further complicates the human body. Second is the pneumonia, which is also known as the infection of the lungs. Yes, some of the microorganisms which are inhaled by our respiratory system go directly into our lungs, which affects our bronchioles, trachea, larynx, and alveoli, air spaces, which further complicated, further becoming the pneumonia-like the conditions and causes many health problems into the patients. Then third one is the endocarditis. Endocarditis is also known as the infection of heart chambers and the valves. Yes, there are many microorganisms which are directly which enters into the blood, and with the circulation of blood through our parts of the body, it reaches to our the heart. Then further complication can occur are the osteomyelitis or the bones. These are affected. There may be the inflammation or the decalcification or the deformation of the bones. It means the bones of the patient becomes weak because of these infections. Then there are the several guidelines used in the New Zealand and internationally. Yes, these microorganisms not present only in the New Zealand, but they affect the whole world in with their infections. So there are many guidelines which are working nowadays so that we can reduce the infection so as to prevent the health status of the persons. So since the prevalence of the infection is higher in the New Zealand, as we are talking about the S. aureus and other microorganisms, these are commonly common in the New Zealand and all over the world, lead to the more deaths due to the lack of the knowledge. Yes, lack of the knowledge, as every person is not belonging to the medical profession. They don't have the knowledge about the microorganism, and they're about their knowledge that how they are affecting the health status of the person. So without the lack of the knowledge, they remain unhygienic. They do that environmental sanitation is not proper. Their lifestyle is not good. Because of these like problems, they are getting many of the infections. So the hand hygiene, New Zealand implementation guidelines were implemented with the district board health for ensuring patient for the safety and provision health within a defined geographical area. Yes, so as we have discussed that hands are the direct contact of the transmission of the infection. So plays a vital role. Hand hygiene plays a vital role to reduces the risk of infection in the areas. So since the prevalence of infection so, since the urinary tract infection is common in the New Zealand, yes, another example is we can check about the urinary tract infection. Like these kind of infections are common, so the majority of the guidelines follow few control practices of reducing infection. So, as there are many patients which are getting admitted day by day into the hospitals and they need to be catheterized who are not able to void themselves, we have to insert catheter. And if we are using that catheters without using the hygienic conditions, that is without using the gloves, so these catheters are we are going to insert them directly into the body, which affects the bladder of the person, and we are giving direct infection to the person. So it's very necessary that whatever the procedures we are doing in the hospitals or in the community, they should be sterile procedure, there should be proper hand washing, there should be proper wearing of the gloves. So for controlling the UTI, the catheter associated urinary tract infection bundle must use, which ensures that catheter insertion is done in the sterile way. So, according to the Center of the Disease Control and Prevention of the 2012, every healthcare staff must follow normal hand hygiene before treating the patient and after treating the patient. Yes, if you are providing any care to the patient, it's in the hospital or in the community area, it's very important that we have to wash our hands. And another, as we have discussed, because implementation is always based upon the risk factor, as we have discussed that mode of transmission, that is the airborne. So airborne infection. So if we are if we are visiting to the crowdy areas, or the crowdy or area, or the public areas. So if someone is sneezing, we need to use the mask or the proper handkerchief, so that these infections may not go to the another person who is very healthy. So because of these infected microorganisms, others carry infection very easily. So use of these PPTs, which are known as the gloves and handkerchief, masks, it's very important to prevent other persons to the other healthy persons from these kind of microorganisms. So, if patient is admitted into the hospital, it's very important that we can keep that person isolated. We can isolate that patient from the another healthy patients who are not affecting from those diseases, so that those particular symptoms may not come to the another patients. So, next is the antimicrobial stewardship. Stewardship guidelines are playing very vital role nowadays. These are giving hand so that we can reduce the risk of infection in the areas worldwide. So, antimicrobial stewardship would forces provided to be successful treatment for reducing the prevalence of the nosocomial infection. The aim, the main objective of these guidelines is to reduce the risk of infection from the particular areas. So, according to the Center of the Disease Control and Prevalence, international guidelines for infection control include the practices of the hand hygiene, gloves, and changes of the gloves after touching the patient, or after or before doing any procedure on the patient. Yes, yes, there are so many organizations like the World Health Organization, CDC organization, and the UNICEF, and many other organizations who are working for the welfare of the people. They are updating their data but after some time, so that to give the health education to the people through the advertisements, through the articles, through the journal, through the newspapers, so that these informations can be given to the people who are living into the who are living into the community, who are living into the hospitals. In hospitals, the seminars are conducted to educate the physicians, to the staff workers, that how to maintain the hygiene, how to treat the patients, how to prevent from the risk of infections. Patients, if we are talking about the hospital, I before the admission of the patient and after the discharge of the patient, it's very necessary to fumigate the private area, or the private ward, or the room where you are keeping that infected patient, so that these microorganisms may not shift to the another patient who are coming into the hospital, or who are already in the hospital. So there are many methods by which these fumigation is done. So after doing this fumigation, the area can be steriled properly, so as to prevent the further coming patients, and they can be prevented from the infections. So, by concluding my topic, thus it can be concluded that the prevalence of the nosocomial infection increases the economic burden of the hospital and mortality rate. Common mode of transmission is direct contact with the patient. Therefore, by the following guidelines of New Zealand and the international, infections can be controlled by using the evidence method. Yes, to concluding this, I am discussing that these put overall these infections put burden on the economic status also. Obviously, when any person is getting infection, they are getting disease condition, they have to hospitalize themselves, and sometimes if these problems become crucial, they need to for the further investigations of the surgical procedure. Obviously, they affect the economic status of the person and the community. So it's better to reduce these kinds of problem. It's better to maintain the environmental hygiene, to maintain the personal hygiene, hand hygiene, so that these kind of infections can be prevented and we can reduce the mortality and the mobility rate of these kinds of infection, and we can keep ourselves very much healthy. So thank you.